Hi, my name is Jocelyn Mazapanta Asensio. I'm going to talk about therapeutic clinics of amyloid by antibodies to serum amyloid P components. Definition: the amyloid fiber deposits that cause systemic amyloidosis, always contain the nephrofilar normal protein serum amyloid P components (SEP).
So the network centre across the Northwest is important because it enables us to connect up with each other. So we're not just one institution, we're working across institutions. It gives us that flexibility, that facility to be able to link up, to be able to share ideas, to be able to work together on different aspects of the research that we're doing. So that what is a strength, say in Manchester, is complemented by a different strength in Lancaster, for example. So that's what's important about the network, the local network, and then clearly we go across the country when you start taking into account the national network.
Application in nursing. Current treatments consist of support or replacement of flailing organs and measures to reduce the abundance of the amyloid fiber precursor proteins, a sufficient reduction of precursor supply, arrest the accumulation of amyloid and can reduce mortality and mortality.
Amyloidosis is the term used to describe a group of diseases in which deposits of an abnormal protein, called amyloid, form in tissues and organs throughout the body. Proteins are important molecules involved in almost every structure and function within our cells. They are made up of chains of smaller units called amino acids, which fold themselves into three-dimensional structures. Folding allows the protein to work properly and interact with other molecules. In amyloidosis, proteins are made in the normal way, but when they are released from the cell, they open up again. These abnormally folded proteins collect together in long chains or fibrils. The deposits they form are called amyloid. Amyloid fibrils are difficult to break down, and as they accumulate, they start to cause damage. Eventually, the build-up of amyloid fibrils stops the affected tissue from working properly. AL amyloidosis is caused by a bone marrow disorder. The bone marrow produces blood cells, including plasma cells, a type of white blood cell that forms part of the immune system. Plasma cells make antibodies to help fight infection. Each antibody is made up of 4 protein chains, 2 heavy chains and 2 light chains, which attach to each other to form the complete antibody. In AL amyloidosis, the abnormal protein that builds up and causes problems is the antibody light chain, hence the name AL amyloidosis. Instead of attaching to heavy chains, the abnormal light chains open up and bind to other abnormal light chains to form amyloid fibrils. These gradually build up over time. Amyloid light chain fibrils can occur almost anywhere in the body, but the organs most commonly affected include the kidneys, the heart, liver, spleen, nerves, and the digestive system. Treatment for AL amyloidosis involves chemotherapy, steroids, high-dose therapy, and stem cell transplant, and other drugs. Treatment is aimed at reducing the plasma cells to stop further amyloid light chains being made that would otherwise build up in tissues and organs. It also gives the body a chance to break down existing deposits naturally. However, on its own, this process can take many months or years. New treatments which break down the amyloid deposits more quickly are currently being tested in AL amyloidosis. The hope is that they can reduce symptoms and restore function quickly, and in doing so, improve quality of life for patients.
Pros and cons. Pros: reduction of amyloid-based disease and major compression over association disease such as Alzheimer's. Cons. Treatment was effective in visceral amyloid deposits but not in hepatocyte amyloides organs, therefore neither in masses amyloid loss. You should apply in Ecuador. At least 65% of cases of systemic amyloid are deep monoclonal immunoglobulins light chain type Skyback B cell discretions, a total of system pains 18 to 70 years of age, as differentiation types of basal from systemic amyloid we screen as ventilators.
Yeah, we know that there are clinical trials ongoing, and the experience is now that you have probably to start earlier and early. Here at the meeting, one is talking a lot about preclinical stage, where you probably almost have normal condition, but you are a risk group because you have pathology in your brain, and that probably in the future might be an important group to treat if you have a drug that really can influence the pathological cascade with disease. I personally think also that inflammation, which has not been discussed so much here at the meeting, is important and might be very early, also early change in the disease that we probably in the future both have to try to measure and also probably interfere with in drug treatment.
Conclusion. Treatments with CPHPC program by anti-SAC antibodies safely trigger clinics of amyloid deposits from the liver and some other diseases. Thank you very much.